Welcome. Jump into the Compassionate Leaders Circle podcast, where leading with love isn't just nice, it's genius. I'm Laurel Donnellan.
And I'm Daryl Brown. We'll unpack business strategies infused with empathy and action, driving both profit and purpose. Our world is ever-changing, so discover how the savvy leader wears compassion as their power suit.
Hello, this is Laurel Donnellan, and I am so happy to have my fellow Michigander, Emily Cordes, here. Dr. Emily Cordes is a partner at Root Functional Medicine, and she is my doctor. We're going to talk today about her practice and how functional medicine may be different than what you're used to with primary care. So welcome, Emily. So happy to have you.
Oh, well, thanks for asking me to join today. I'm super excited for the conversation.
I'd like to start where you and I started, on a plane from Chicago to Grand Rapids. And one of the things you talked to me about was how primary care versus what you do, one of the advantages of what you do is you're really able to leverage all the research that is available that may not be as available or as used in primary care. Can you start there and talk a little bit about that?
Well, let me first start a background about the difference between what you're getting in the primary care world versus a functional medicine approach, because I think that'll help us get into your question. So primary care, first of all, I want to say there is such an important role for primary care physicians in the United States, but because of limited resources, and really that's a resource of time that's so limited for PCPs, they don't really have the ability to go in depth with an individual's health, talking about risk factors, lifestyle, nutrition, those kind of things. Functional medicine is a different way of thinking about both disease, chronic disease, and then also wellness in general. And what we're looking for in functional medicine is, what is the root cause of the problem, right? So yeah, we need to know what the problem is. I need to say, is there a disease present? That's the tip of the iceberg. From there, then we've got to say, okay, well, what led this individual down this path, right? Because we don't just, for many chronic diseases, you don't wake up in one morning and just it's there, right? It's something has been leading to this. If that means that it's a nutritional factor, lifestyle, environmental, something has led down that path. So that's sort of the difference of different approaches. When we talk about more cutting edge science, because I think that's what you're trying to ask, functional medicine has tools at our disposal that primary care docs don't have. And that's mainly because insurance limits what your primary care doc can do in some ways. The other thing that a big paradigm shift from more conventional to functional medicine is that conventional doctors are usually practicing, I think the research shows, about 10 years or so behind science. And that's because by the time science is published, right, and then to be teaching it in medical schools or continuing medical education, there's a delay there. To then get it approved by insurance, there's to go through that red tape, there's another delay of a few years. So when you add up all those delays, you're receiving care that maybe is from, 2014. Lots of new data is out there on how we can keep people healthy. So it's just a delay of a lot of red tape and a lot of education. And when we have different training, and then once we cut insurance out of the mix, we're able to provide a level of care that really is more individualized and really looks at the root causes of symptoms and chronic disease.
And as a patient, I have great primary care providers. I have a great surgeon. Listeners, why I'm working with Emily is because I have arthritis. I'm going to be fine. I have a surgery on my shoulder coming up, and I'm very fortunate that I can use your company and primary care. Can you tell me about how it works at your company? What's the process?
Yeah. So root functional medicine has multiple ways you can access us, which is sort of great. If you already know that you're interested working one-on-one with a physician and a registered dietitian as a team, because that's our model, you can sign up to work with any of our clinicians. And we are, gosh, I think we're in 43 states. So there's just a few select states that we don't work in. So you can just join us and work with a physician. Alternatively, though, you can gather a lot of data on yourself to understand your own health and your own chronic disease risk factors and maybe your nutritional status through our Access membership. So it allows you to have a lot of community support and learn about your health and get the data through lab work. And for a lot of people, that's what they're looking for. They want knowledge about where they sit from a health standpoint. And then if labs are maybe abnormal or you're looking for more assistance, you can always upgrade to then see a physician and a dietitian. So multiple access points.
And I so appreciate that primary care people often don't have a lot of time to spend with their
Yeah.
patients. And working with you and my nutritionist, I have a lot of time with you, and you get to know everything about me, and it's been super helpful. I'm curious how you see the future of this is because I imagine if this was in place, world, and affordable for everyone, it would prevent disease and lower
Yeah.
costs long term. Like, is that even possible? Is that the dream?
That is the dream. Yeah, it really is the dream. I think that, I feel like we're really on the cusp of the future of healthcare, at least in the United States. There's a lot of work to do in the future. I'm going to be honest, right? Like from a societal perspective, part of this is the shift out of like pill for the ill medicine. And what I mean for that is that, for hundreds of years now, a couple hundred years, physicians and the medical community, we've been asked to find the disease and then give the pill. And that could also mean like just a surgery, very like it's a simple fix in some ways. That mindset works really well when you can cut it out, so surgery, right? Or it's an infectious disease where we know we've got one, antibiotic, et cetera, that fixes it. That doesn't work for chronic disease. We don't see the outcomes we're looking for when we treat chronic diseases that develop over 25, 30 years with this pill for the ill mentality. So really the shift of looking for the root cause is going to need a much longer, it's going to need a shift in how we think about both disease management, but also like what does wellness really look like? So the work behind that means that, future physicians are going to be trained differently. Current practicing docs are going to need to start thinking differently. But behind just the medicine, we've got this whole medical, pharmaceutical, industrial complex that is a giant, and our government is obviously wrapped up in a lot of that. And there would need to be a significant change in that industrial complex. And I think our culture is ripe for it. We do need it because we're spending so much money as a nation on like pretty mediocre health outcomes, honestly. Like if we compare ourselves globally, we're not getting an A on this report card, honestly.
So for those of us who have struggled, I mean, I've been dealing with arthritis. I mean, I could probably track it all back to like when I was 8 and doing gymnastics and having injuries. For those of us that are interested in health and interested in being healthy and interested in wellness, which is most of us, right?
Yeah.
How do you as a novice, not a doctor, figure out what is factual and what is fake? It's kind of like fake news for health.
Yeah, so that is such a good question because we are inundated with, I mean, if you're on social media and if you hop on and just read some articles, there's always the new thing, right? That's telling you how to live your life, even in the nutrition world, right? Like, do you believe that you should be vegan or like carnivore or plant-based or like do you go keto or intermittent fasting, right? Like, and you could find data for any of those nutrition plans. So where is the truth, right? Now, I will say, like the wellness industry, it is an industry. So I think we need to keep that in mind about when you see new fads coming in. The role of, at least how we see what our job at Root is like we're trying to sort of cut through some of this, if you want to call it BS. That's sort of what it is. There are lots of helpful tools and products on the market. Not all of them are helpful, though. So I think finding a reputable source of information is important. And that usually does mean that we've got to weigh like our credentials important when you read them. I think in some ways they are. I think looking through, is it physician endorsed? Is it dietitian endorsed when it comes to nutrition? I think that is helpful. I think it's okay to always have your senses up that like, oh, is this truthful? Instead of believing everything you read.
Yeah. I follow one person around wellness who wrote a book called The Wellness Trap. Her name is Christy Harrison.
Mm.
Um, she's a journalist that does a lot of deep dives into the nutritional studies and has found that a lot of them aren't that big or might have a really narrow, like white college women between the ages of 20 and 24, which have a different body and profile than me, who's 64.
Yep.
Yeah, so I find she's very helpful, and her podcast and books she's very much on a journey like all of us. Like,
Mm.
what is really causation? In a way, I find it helpful, but it's very, very hard to not get sucked into the internet. The other thing that she's found is sometimes dietitians get paid by the people that they're pushing. So
Yes.
it's not necessarily a reputable endorsement. It's just, sort of a influencer getting paid to push something. So we just all have to be super careful.
We do need to be careful. I think I could go down a rabbit hole, but my dietitians would honestly do it better about the economics behind the RD world. And even in in their university setting about who's funding, bigger corporations are involved with RD training nowadays. And yeah, it's not quite as cut and dry as well, this is what the whole world should be eating, right? Yeah, that's a hard world to navigate. It's almost like the more information you have, obviously the more choices we've got and the water really gets muddy. So, when we put out anything on our Root website, blog, nutrition advice, being part of Access in our community, it's pretty well thought out that the recommendations that we've got out there are science backed, but also we see it working in practice. And I think that's what's important is that, there are lots of 8-week studies out there to say some nutrition plan works well, but can that 8 weeks be extrapolated out to like 8 years, right? That's the question. And we see the nutrition plans that we recommend, we see them work in real time, in real life, where you're still going out to dinner occasionally and you're still living a normal life. You're not in a lab. And I think that's important.
Yeah, so important. So just for myself and my listeners, I bought an Apple Watch a
Oh,
couple weeks.
yeah.
And my question to you is well, I'm still learning how to use it, but how can I use it in a way where I don't feel bad? Like I want it to be my friend and not my, school
Uh-huh.
arm, how do you use an Apple Watch if you're new to it in a way that can be helpful rather than disappointing?
Yeah, so I will say this is for like Apple Watches, Garmin's, or Rings, like any device where you're tracking, even like some folks have continuous glucose monitors nowadays. Before you even apply the device, wear the watch. I think you should know who you are and know how much you might get trapped into this device. So just, recognize like, hey, do I really get into stuff like this or not? I think those tools are helpful to train us in the short term. I think they give us really good feedback and help us sort of set goals that are achievable, right? Meaning that let's put the example out there of like if you're currently walking 3,000 steps per day, let's say that. And the Apple Watch defaults to like 10,000 steps a day. And you, for a week, just keep getting told that you're not doing your goal, that you're just not meeting your goal. You're not closing your rings, right? I think we need to say, okay, like, is that goal appropriate? And do we need to back it down to say 5,000 steps a day for a couple weeks? And once you're hitting that goal on a regular basis, then we reset the goal, right? So I think there's that way to look at it. I always recommend for folks who like their devices that they should occasionally take a break from their device. So if that means that they take like a Sunday off and they don't care about how many steps they're getting, or if it's like they've done it for 4 weeks, we're going to take, 3 days off. But I think just from our mental sanity, we're not supposed to be recorded on everything we do as humans. So we can give ourselves some grace and not wear it 24/7, 365.
Well, I did that for a couple weeks, but I've already started taking weekends off because I find I move naturally enough on
Mm,
weekends. So I'm just trying to like back, but I do appreciate, I've always thought I was a good sleeper, and I do appreciate the sleep data
yes.
because that made me feel good because my I used to say to people that I'm a champion sleeper, and now I have the data to back me. So I'm proud of that. I actually said that to a friend the other day. It's like I can help you sleep, you can help me move. So
There you go. That's good teamwork.
teamwork. Where did 10,000 steps come from? Like,
I think so. There's not much research on the 10,000 steps. It's sort of a like number that's been thrown out there. But I do know that 10,000 steps started to be used in activity research after someone threw it out years ago. So it's not like they pull, I don't believe, and we maybe have to check this, but I don't believe that they averaged a bunch of humans that were really healthy and said, well, these people seem to walk 10,000 steps per day. I don't think that's true. I think this was sort of that maybe that's a good goal to start with. But I will say, I mean, even though maybe there's not a lot of science behind it, I think 10,000 steps a day is a good place to start for people who work office jobs, especially,
yeah.
or you're working from home, because it's really easy in those positions to start, that around your house, you're at like 3,000 steps a day. And unless you take a concerted effort to go for a walk or exercise, you'll probably just stick around 3,000 steps a day. And that's not enough activity for us.
Yeah, I find that that's been helpful. Like I am pushing myself out the door. That part's helpful because I do sit for most of my work.
Mhm.
Emily, tell us a little bit about your background and your story of how you got into medicine and how you switched over to this type of medicine.
Okay, yeah. Well, I was not the like little kid that said they wanted to be a doctor. I pretty much, gosh, I was sort of a nerd growing up, meaning that like I got A's and like, yeah, I guess that's a good way of explaining it. And I think along the way, somebody told me I was good at science. So I was like, oh, I'll look into that. And I enjoyed the sciences in general. Went to a small college here in Michigan and started doing some chemistry classes and really enjoyed that, but also realized that I was not cut out to work in a lab all day, that I really missed working with people. So did the med school route, stayed local in Michigan, Michigan State for medical school, and actually residency was a Michigan State affiliate until it turned into Western Michigan. So I've been actually like primarily very local in Michigan. I love Michigan. So, sort of like that straight path through. I didn't take any breaks between my education years. So, you're out of residency. I did residency in internal medicine and pediatrics, which gets you board certified in both in a shorter time span. I get out of this at 30, right? I was 30 years old at the time. And I'm like, okay, well, I'm going to go be a primary care doc because that seems like the most like how I can make my impact on the world. I was thinking, gosh, I can really like help people prevent disease. I can get people healthier again. I was very naive, I guess, is probably the appropriate word. I don't think I fully understood there was much more forces in the world than just me trying to help every individual. So this was all pre-COVID, by the way, so which is a different world for all of us, I feel like. And then I'm in primary care and I'm realizing it's like not what I thought it would be, frankly. Even in the first like 6 months, I saw people that they would come in with a problem and then I would treat it and they'd come back and I'm following these guidelines, right? The guidelines that like physicians we sort of think they're like our practice Bible, right? And I'm following the guidelines and they're coming back 3 months later and nothing's better. And I'm just up in doses, right? I'm like, okay, like let's go to the next dose. Let's go to the next dose and let's try a different med. And I realized that I'm like, I'm not curing disease here, right? There's no cure. There's just like management as people go downhill. And that ate away at me, honestly. I did not feel good about that. So I started looking at different, like, do we need to think about this differently? And there are different schools of thought in the United States about like chronic disease. And I landed on functional medicine because they did talk a lot about like, what is the root cause specifically for that individual, right? We can say that the root cause of diabetes nationwide is, a few things. But do you want to use a nationwide template for your healthcare? Like, no, you want to know what your root causes are. How do we reverse them, right? And I was really intrigued by the way that's a different way of thinking about chronic disease. So I went ahead and started training in functional medicine. And after like 2.5 years, I was certified, several programs that you go through. And then I very serendipitously landed at Root Functional Medicine about 4 years ago. And it's been a wonderful like change in my life to go from primary care into functional medicine. I would never turn back.
So how is your day-to-day life different as a doctor now than it was when you were in primary care?
Yeah, I think the biggest thing is the amount of time I'm able to spend with people. The platform, like I do work virtually because I see folks all over the country. That isn't what I consider the biggest change. Like it looks logistically different, right? But the way I am able to sit down with somebody for 45 minutes and talk through their whole history as a physician, that was my expectation in residency, that I would really get to know people and I would know their stories and I would be able to connect those dots or put the puzzle together in their stories. And I can do that now in functional medicine. And I could just not do that in primary care in like a 15-minute visit. So that's the biggest difference. I mean, I see 6 to 7 root members a day, and I am able to, the next morning think through their whole story and be like, oh, light bulb moment. This is what's going on, right? And I think that's what we should be able to do as physicians. But when you're seeing 25 patients a day, there are very few light bulb moments when you're just like moving and hustling in primary care. At least that was my experience.
Yeah. And as a patient, I can talk to Emily like through messaging or talk to her between appointments. And I see a nutritionist that works with her. So it's a very different experience. And
Yeah.
and I also feel privileged that I can afford it and do it. And yeah, like you said, there's lots of resources that you have that you're screening the information. The information is well researched and well founded and well thought out. So I'm a big fan of what you do and how you do it.
Get that.
And I hope at some point that everyone can have access to this, in the future. Like I hope that it can become more accessible.
Yeah, I mean, that was one of we recognized that a while back, that functional medicine, even on a nationwide scale, is not incredibly accessible, or it wasn't a couple years ago. So that's why we really pushed for an access membership that people could get their journey started and have, well-researched, well thought out health recommendations. They can get some of their data and there's not this, security rope around their labs. If they want labs, they can go get their labs. Like we should own our own health data. And putting that together, it really gets people started on a wellness journey. Then they take ownership of their health. So I think, our price point is more at like most folks can sign up nowadays to get their labs drawn. And then I think, in the future, you're going to see more employers jump on so that this is a better option to take care of their employees instead of going the traditional healthcare, health insurance route, or especially for like self-funded or self-pay employers, that they can add a root membership for their employees so that they are decreasing costs over the long term. So
yeah, that's great. Before you leave us, I love to end our podcast with one life lesson you want to share and one leadership lesson.
Oh gosh, yeah. I think leadership lesson, and I had to learn this as a younger leader. Okay, so I'm looking over at my bookcase now, and I have like a bookcase of leadership books, and I have read them all. And and I think that you've got to figure out what resonates with you. And what's funny is I've read these books, and sometimes I agree and sometimes I don't, but I feel really not very genuine when I try to model someone else's leadership. So I think that just because you don't find your leadership style written up in a New York Times bestseller doesn't mean that that's not your style, and you should recognize it and stick to it.
Nice. And for life, what life lesson?
Take the risk, honestly. And I tell physicians this, I tell friends that aren't in medicine at all, if you've got an opportunity if you are not enjoying where you're at career-wise and you think there's something different, you should take the risk. And like God will carry you through that and it will work out.
Great. And how do we learn more about you and your practice?
Yeah, so you can visit rootfunctionalmedicine.com, and that's where you'll see blogs and membership info and all about us as a company. Then on social, you'll just find us under Root Functional Medicine. It's pretty much the same. So
Great. Thanks for your time today. I so enjoyed our chat.
yeah, of course, it's been great. Thanks.
And that's a heart-wrapped episode of the Compassionate Leader Circle podcast. May your compass always point to kindness.
As you navigate the world, let compassion be your North Star. Join us next time as we continue to redefine success one heart-led decision at a time.
Lead wisely, lead with heart. You can learn more about us at compassionateleadercircle.com.